Hello, everyone. My name is Joanne Donovan. I'm Chief Medical Officer at Edgewise, and I'm really pleased to be talking to you today about our development program that is focused on muscle disease. We're developing a novel therapeutic agent designed to protect muscle in Becker and in Duchenne muscular dystrophy. I'd like to thank Cure Duchenne for giving us the opportunity to speak. First of all, I need to remind you that we are a public company, and so I'm going to be talking about things that may happen in the future. And most importantly, EDG 5506 or sevasemten is an investigational agent, and it's not approved in any territory. So Edgewise has been on a mission to discover new medicines to improve the lives of people facing serious muscle diseases, and you see some of these faces here. We were founded in 2017, focused on developing muscle-targeted therapies very specifically. And we are the only company that is focused specifically on the muscle injury that is caused by muscle contraction in Duchenne and Becker muscular dystrophy. Our goal is to develop an investigational agent that will be taken as a daily oral pill, used alone or in combination with other therapies, regardless of mutation. So our approach is to protect susceptible muscle fibers. We know that about half of skeletal muscle fibers are more susceptible to damage due to the lack of functional dystrophin. And these get damaged earlier in the disease with contraction. We've made an investigational agent, sevasemten, designed to protect specifically these susceptible muscle fibers from damage, and it's regardless of mutation. We have a number of clinical trials in Becker and Duchenne that are ongoing to assess sevasemten's ability to protect susceptible muscle fibers from injury caused by contraction. And we are using biomarkers of muscle damage, circulating blood tests basically, as well as functional assessments to understand this better. Now, I'm going back to how do muscles contract and how does sevasemten work? On the left here, in healthy muscle, the muscles are basically cross-linked to the muscle fibers by a complex of which dystrophin plays a major role. And that's the blue images there. So dystrophin connects the contractile proteins, the proteins that contract, to the membrane and to the other muscle fibers. So when one muscle fiber contracts, it has the support of other muscle fibers. In muscle that has muscular dystrophy, when contraction occurs, the muscle fibers are kind of on their own. And so when they contract, they take all of the burden of contraction. And in the absence of full-length dystrophin, contraction causes damage to the muscle. Now, this video shows a mouse model, the MDX model that's used for muscular dystrophy. And this provides support as to how the drug might work. On the left, the muscle, the finger muscle of a mouse, is contracting without sevasemten. And you can see that with contraction, you actually get visible damage to the muscle. The muscle fibers rupture when it's contracting at 100%. And you can see that happening. There's a number of things that happen on the molecular level leading to that kind of damage. With sevasemten, what we do is modulate. We decrease contraction by a little bit, and the muscle works fine. But what it doesn't do is it completely protects against that contraction-induced injury that you saw on the left. And that's what we're trying to do with sevasemten. So we have looked at both Becker and Duchenne, and the data in both support each other basically because the underlying disease process of contraction-induced injury is the same in both. So Canyon has been the largest completed Becker study to date, enrolling 69 patients, both adults and adolescents. And this was our first placebo-controlled study. So we looked at biomarkers to understand what happens with sevasemten. We looked at men between 12 and 50 with a dystrophin mutation, and with Becker not on corticosteroids. And importantly, looked at those with a North Star ambulatory assessment that measures daily function, basically, in a zone where we know that they tend to progress. In terms of safety, the most common side effects that were reported are dizziness and sleepiness. You can see all of the information there. And it's been generally well tolerated. What we saw in terms of the biomarkers is that the CK, which is measured, your doctor measures that typically during diagnosis, that went down 28% compared to placebo, and indicating that the muscles are not being damaged as much. That's what we conclude from that. There's also a protein called TNNI2 that is specific for these susceptible muscle fibers, and that went down by 77%. We also looked at function with the North Star ambulatory assessment. And this is the adults. The men who were treated with sevasemten for a year had stable North Star. The ones who were treated with placebo, they had a decrease in their North Star that was similar to what we've seen in natural history studies. That's indicated by the greenish triangle here. So this is encouraging. It wasn't statistically significant, and that's why we have proceeded to a larger study called Grand Canyon that's fully enrolled. It's an 18-month study, similar population of men, and we have enrolled 175 men. That is on track to have results towards the end of next year. So we're very much looking forward to that. Now we're also looking in Duchenne. And we are looking both in boys in the LINK study, boys aged 4 to 9 that are generally on corticosteroids. And we've also looked in the FOX study at boys and adolescents who have been previously treated with gene therapy. Both of those studies are fully recruited at this point. And the goals of that study was really to get the information to identify a potentially beneficial dose for phase 3. So that is understanding the population. And what we did was we looked at biomarkers. We looked at that for 3 months, and then we dose escalated. We looked at a range of doses to make sure that we had the right dose, and we kept going up in dose. What we saw was we went up to a dose as high as 30. This is a single, by the way, anticipated to be a single tablet for both populations. And what we saw at the higher doses is that the boys, we had a bit more in terms of side effects. The boys tended to slow down. So we moved everybody back to a 10 milligram dose. And we found that in the FOX study, we found similar, that we saw a bit more at 30 and even at 15. So again, we went down to the 10 milligram dose, and they've been on that in general, for over a year at this point. And that's been well tolerated. What we saw was, of course, now we are in an open label period where we don't have a placebo group, but we can compare to natural history. And the North Star, we compared to a predicted published model. It's shown on the bottom there. And the boys were up about 2 points compared to what we would have anticipated based on their individual baseline characteristics. We also looked at stride velocity 95th percentile, which is an accelerometer that's worn for about 3 weeks. So it measures what's going on in real life. We saw that was better, basically stable compared to what we would have expected for the natural history. So that's encouraging, and that is with the 10 milligram dose. So that's been encouraging. We're continuing those trials with an open label period to collect longer term data. And we are planning to meet with regulators to get input on the phase 3 design and then move on from there. So to summarize, sevasemten is being developed for Becker and Duchenne muscular dystrophy to preserve and to improve function potentially in individuals living with any mutation of Becker and Duchenne. The goal is to prevent damage to muscle by protecting the most susceptible muscle fibers, either alone or in combination with other therapeutic approaches for Becker and Duchenne. And with that, I'd like to thank you for your attention. We are available for questions, and we are most happy to hear from you, and we'll continue to provide information to the community as it's available. So thank you very much. I appreciate it.